very important in planning. So people who turn positive today, they're just positive. We can expect that of that number that will need hospitalization because they have developed severe illness, that will occur in about 2 weeks, 10 days to 2 weeks. So the hospitalization has that lag from the date of positive test or date of first symptoms. And this is very important in planning. Now, as of today, we have no excess beds in hospitals for COVID patients. And so the system has been overwhelmed, particularly here in Gauteng. People are being turned away to go home without oxygen, unfortunately, and there's a high mortality rate. Now, that may feed into the excess mortality figures we spoke about earlier, because people get quickly buried in certain communities, etc., and the registration lags at Home Affairs for an extended period. And although we are hopeful that there's greater accessibility to oxygen and there's greater experience in the treatment, if there are no beds, that has absolutely no impact whatsoever. So to go to number 9, the major characteristics of this resurgence are related to, inter alia, the cyclical, mainly seasonal surge and ebb of waves of viral respiratory infection. The emergence of variants of the virus that demonstrate greater transmissibility and virulence, the degree of waxing and waning immunity from previous infection, protective personal and state-mandated non-pharmaceutical interventions, and of course, the rate of vaccination of the population. Now, surges during colder seasons is typical of respiratory viruses such as SARS-CoV-2, mainly due to greater indoor confinement, with more crowding and greater proximity, providing increased opportunity for airborne transmission of the virus. In warmer months, there is a significant ebb in transmission with distinctly lower levels of circulating virus. This is by no means the only variable, however. In the case of this novel coronavirus, which has often upended orthodox expectations, seasonal symmetry is by no means absolute. South Africa's so-called second wave occurred during the height of summer from late November 2020 to early February 2021. Now, this was the consequence of 2 drivers of infection, each playing a significant and interrelated role. The first was the emergence of the viral variant 501YV2, or the beta variant, which was first identified here, and which has proved to increase transmissibility, both due to more efficient transmission, as well as an increased ability to evade neutralizing antibodies from previous infection and reduced vaccine efficacy. Now, this latter effect was not significant because South Africa had not yet begun its vaccination program when the second wave was in full swing. So the second driver of infection during the second wave was the numerous gatherings during the festive period, which created the ideal conditions for the beta variant to spread exponentially. These super spreading events were widely distributed, resulting in large simultaneous outbreaks throughout the country. I'm sorry,
There's no interruption there.
Oh, okay. No, she came by and I managed to get away with Mr. Mapan. I'm trying to see if we could.
Sorry, Justice, can I be heard?
Yes, I can hear you quite clearly.
Okay, all right. Sorry, I'm getting a lot of conversation.
I've asked it to get us another 16
and I'm not able to hear you clearly, unfortunately. Okay, let's try again.
I think the silence the intruder, so go straight ahead.
Okay, good. These super spreading events were widely distributed, resulting in large and simultaneous outbreaks throughout the country's coastal provinces initially, spreading later to the more inland provinces. By all measures, this second wave was more severe and debilitating to the healthcare system than the first wave during the winter months of 2020. I don't know if you have any questions on that, Justice Moseneke, because the second wave was quite atypical.
Projections about the third wave, and where it will be around October 2021.
Let's go there.
But wait until you get there, because we are just about to deal with the Delta variant.
Yes, we'll do so shortly. Okay, so let me proceed then. Given that the majority circulating strain of SARS-CoV-2 in South Africa currently is the beta variant, and here I have to make a correction, sir. As of the last 3 days, the dominant strain we believe now in South Africa is the Delta variant. And so please take this point as advised with that fact. The third wave shows every sign of matching the amplitude, that's the height, and wavelength, that's the duration of the second wave. Now, the circulation of the alpha strain first identified in the UK was fairly low during South Africa's second wave, but is showing signs of slightly greater prominence in South Africa during this wave. But it is unknown at this time whether it may be contributing to the resurgence. Well, it is now known it is not contributing significantly to the resurgence. The Delta variant, recently identified in India, has shown alarming rates of transmissibility and virulence, and is now the dominant strain in the United Kingdom, and as we have heard, in South Africa as well, eclipsing both the alpha and beta variants there. The Delta strain is also presently circulating in South Africa, albeit, and again, we must correct this, it's at high levels. And this explains the very steep curve that we are seeing, especially in Gauteng. Now, this is important to note in that it may increase in dominance in South Africa later this year, but it's already here, I should say, Justice Moseneke. And I hope I'm clear on this point. In what is written here.
You're clear, but verified me prospect, yes.
Good, okay. Now, there are early indications that in inland provinces, at least, the peak of the third wave may exceed that of the second wave, with its attendant consequences for the population, the healthcare system, and the economy. On this last matter, it should be noted that the government has little or no room to further restrict economic activity without causing great financial and material distress to people and lasting economic harm. This accounts for its fairly light touch restrictions currently. Again, this was before the president's announcement last night, which was slightly heavier touch restrictions, that is adapted level 4, which may well have to be revisited, as he did, should healthcare services be overwhelmed, as they are. Now, current restrictions limit gatherings to 50 persons indoors. Well, they are all prohibited now. The only gatherings where 50 persons are permitted is funerals. So you can ignore that. In order to attenuate the effects of this resurgence, our view is that for the duration of the surge, there should be a blanket prohibition on non-essential gatherings, including religious, sport, cultural, similar events. And the president has actually done that through his announcement last night. Now, this does not apply to COVID-19 compliant workspaces, public transportation, or schools. Well, it evidently does now, particularly schools. That being said, current policy on allowing full occupancy in taxis poses a material risk to both commuters and drivers, more so during the winter months when air circulation and ventilation in vehicles are curbed. This is a relevant point for the risk assessment of the elections. As for schools, the scientific consensus that children are mostly asymptomatic if infected, are very poor transmitters of the virus, and do not pose a risk to adult staff, provided that personal protective measures are diligently applied. Infection in pupils and adult teaching staff occurs overwhelmingly in community settings, not at school. This points to the need for greater adherence to personal protective measures by teachers, greater parental control over children gathering with others outside of school, And school closures may be necessitated if the surge in infection is so excessive that a broad limitation on all movement becomes necessary, as it has now become. And the schools have been are in the process of closing, bringing the end of term forward. While many countries have held elections at various times during the pandemic, their experiences of creating a greater risk of greater transmission is mixed. This is primarily reflected through the different socioeconomic conditions of different countries, their relative rates of vaccination, the prevalence of variants of concern, and they are listed, size and homogeneity of populations, percentage turnouts, electronic voting, and the efficiency of in-person voting. So, Justice Moseneke, I think that last point is very important. We have experience now, whether it's in India, in the United States, in Europe, in South America, where elections have been held during COVID-19 and with all measures put in place that they could. But after each election, you can plot an increase in the number of cases and an increase in the number of deaths. And the direct line to the holding of the elections is pretty clear. Yeah. And this is mostly common cause at this time. So if I could now... Yes.
This is why somebody made submission to us, this Ms. Hassan, really, that we may want to look at studies that were made about during and post-election infections and to see what the numbers look like in order to try and assess the risk to body and life. I mean, but then the imponderables are ever so many. Look at paragraph 20. The size and homogeneity of the populations, percentage turnout, electronic voting, efficiency of in-person voting. All those variables will tend to differ from country to country, wouldn't they?
Correct. And will also, affect the size of any resurgence. And that is important. So we have to take the view that we are applying this risk matrix to South Africa with its attendant socioeconomic position, its size, and so on, as we've listed there. And so our risk matrix is designed for that environment.
Yes, before you leave this part and get to the hustings, of course, I must be concerned with what is likely to happen with the resurgence in October. Where actually be? There's a suggestion this morning by one of your colleagues that around October, the third wave would have subsided. Do you have any take on that? Do you have any opinion?
Yes. Yes, I think on a historical analysis, we would expect that this wave will crest and start to decline. Later in July, perhaps toward the end of July, beginning of August, it will reach a level where it's no longer regarded as a wave in epidemiological terms. But it must be noted that all that means is that the surge has dropped. So it drops to a baseline where there is still circulating virus in the community. And we talk to that later. And that infection is still very possible, and that restrictions may well have to be in place on, for example, large gatherings and so on. And it's a guess at this point, given what happened in December, where we did not expect a wave, that as we come down off the third wave and restrictions are lowered and people start moving around more freely, get more complacent, that we could kick off an early fourth wave. Now, this is speculative. There's no certainty around this, and it will also depend on where we are when we decide that the third wave is over at the beginning of August. So it is a prediction, and it can't be stated with absolute certainty, but based on historical trends, one must accept that there's going to be appreciable amount of circulating virus during October in the country.
Thank you. I know you deal with that under C later, but
Yes.
I'm looking ahead for you to run through the presentation and we can come back to the few asking questions.
Sure. So we go to the COVID-19 risk matrix for the local government elections, and we can extrapolate the following risks attending the holding of elections in October 2021. So what I've titled To the Hustings, this is the pre-election period. And the current levels of lockdown and attendance restrictions are likely to remain in place for at least 4 to 6 weeks, up to the end of July at least. Political parties engaging in electioneering are likely to do so during the months of August, September, and October, when it is hoped the rate of infection will be much lower and restrictions will be eased. Now, if I may just pause here, Justice Moseneke. The events of last week, where political parties engaged in certain activities, one was a march to the regulator's office, the medicine regulator's office. Another was the congregation around the High Court, where a senior member of a political party was on trial. Both of those events were in open defiance of the current restrictions. And it is a concern that restrictions will not create sufficient pressure on parties to desist from such activities. And given the very fractious nature of our politics, we can expect that there will be willful and deliberate, violation of the restrictions in the interests of certain political parties. And unfortunately, that is a reality that will have to be factored in as we go forward. But let me proceed. It is very difficult to predict with any level of certainty that circulating virus during this period, with a forecast based on historical trends, will be at the level of previous troughs, that is the end of the wave. Even though October is the beginning of the summer months, the natural seasonal abatement of circulating virus may be confounded by the emergence of new variants with greater transmissibility. And at the time of writing, the Delta variant was very much in our mind. And we know that the Delta variant is 64% more transmissible than the Alpha variant in the UK, and it seems also the Beta variant. And both of these are currently in circulation in South Africa. And as you can see, we said that the Beta variant remains dominant, and that news changed a few days ago. It is now Delta. So events have moved forward along these projections. Moreover, the resumption of non-essential activity and gatherings, which will follow the lifting of restrictions during this period, that is during the trough, has previously been shown to be a proximate cause of non-seasonal resurgence, as witnessed during the last wave. That's the second wave. Excuse me. And we make reference to that in points 10 to 13. The voter registration program planned for July 16th and 17th is going to fall squarely during the peak or the cresting of the current wave and poses a material risk, if not from the registration venues, then from the concomitant movement of people during that time. So it can be expected that the pressure from political parties to undertake political activity, such as rallies and community mobilization during the months of August, September, and October, will be high. These events are virtually certain to be direct causes of greater transmission. So now we come to the voting on October the 27th. If the run-up to the plebiscite will increase the likelihood of greater transmission, then the actual act of voting will have its own itinerant risks. Getting to voting stations will necessitate the use of public transport for most voters, and the mingling of people prior to arriving at voting stations creates a higher probability of transmission. The IEC has reportedly and in its submission rightly confined its responsibility to ensuring that voting stations are oriented towards proper COVID-19 compliance. We are confident that the IEC has the wherewithal to ensure the venues are safe. We have submitted some slides from my colleague who couldn't be with us today, Professor Goldstein, who unfortunately suffered a bereavement in a family, but she speaks to exactly this issue regarding safety at venues. However, on the ballot,
slides, and very grateful that she made an effort, though in bereavement, to give us the slides. Please convey our gratitude for that. That's certainly helpful and certainly before.
I shall do so. Thank you. However, on the balance of probability, having uniform adherence across 23,000 odd voting stations will not be possible. And even if any lack of adherence is confined to a minority of stations, these may well be sites of accelerated transmission. So that, we believe, is the risk matrix for the day of voting.
Let's just take a pause, Dr. Nancy, and say, one of your colleagues presented earlier today about just the level of uncertainty, the behavior of the virus, and with variants that come up, and levels and intensity of potential transmission. Now, many of the submissions before me state that we're likely to have the pandemic around us for quite some time. Do you take also that view? In other words, implicit in that is that even if you were to consider a postponement, you're very well going to find yourself in an intractable position where you are faced with a higher resurgence, and therefore the democratic project will be under real threat. I wonder whether the question is, will the pandemic be with us for a while, even within the speculative range? And if so, will we be faced with a situation where we want to postpone forever and ever?
Okay, it's a very fraught situation, sir, I must say. And I think the way to consider this is that, yes, it is a fact that the pandemic will be around for a while. Even in countries which have high rates of vaccination, hoping to reach the fabled herd immunity status, have now had severe setbacks because of the arrival of these variants like Delta, and which has upended a lot of their planning. And this is by no means the last of the variants. So these variants may well emerge periodically. The attempt to get the world and countries beyond the emergency phase of the pandemic centered on achieving a level of population immunity, called herd immunity, where normal life could by and large continue, because the ability of those who are not vaccinated and who may be infected to transmit to others is severely reduced. There is what we call the R number, that's the reproductive rate of the virus. That means how many other people can one person infect. If the rate is below 1, then we have a very good basis for saying we have probably reached herd immunity. But this is a very speculative projection that we would do so in good time to continue with a postponed election. I must say that had South Africa begun its vaccination program earlier, as other states did, we may have had a higher level of vaccinated people. But we will also have suffered the risk that highly vaccinated populations are also experiencing, and that is breakthrough infections from variants. Now, the scientific consensus globally at the WHO and here is that this current generation of vaccines, which is our most potent means of protection, are only effective against severe disease, hospitalization, and deaths. And they have an appreciable level of protection against those eventualities. However, they show much less efficacy for getting mild or moderate disease. And in fact, that's where a lot of the spread occurs in people who have mild disease, maybe asymptomatic, maybe symptomatic, and so would be able to spread the virus. And that's why I said this is a very fraught matter, because not just for the elections, but for society generally, we are going to have to accept that the end of the pandemic is not going to be an event. Indeed, we believe that when sufficient vaccination by the next generation of vaccines, which will be more effective and perhaps get us to herd immunity, the virus will then become endemic. That means it will stay within the population, circulating at a very low level and having periodic resurgences, much like the flu virus. And that's why we are, sorry, please.
No, not at all. I interrupted you. Please finish your sentence.
No, so that's why we believe that projecting for the end of the pandemic is not very helpful. What may be better would be to get ourselves and the population to a level of immunity through vaccination that also protects against mild and moderate illness, which the current generation of vaccines do not do very effectively. However, the pipeline of new vaccines is strong, and we can expect that new candidates will now be speeded up through their testing processes and perhaps then being made available worldwide. How long this will take, the best guess is that it will be in Q3 or Q4 of 2022 when these vaccines will emerge. We have, of course, the experience of not getting uniform distribution of vaccine around the world. And South Africa now must consider where it will be with regard to accessing those vaccines when they arrive.
Well, it seems to me that it's a true conundrum. You do it with them, you don't do it with them. But let me define the risks closer. Some of the submissions before us, and some will be made tomorrow. Some of the electoral bodies are saying to us, well,
all right, Dr. Dasu there giving his evidence or submissions to the Moseneke Inquiry around whether it's going to be feasible for us to have the local government elections come October, making a lot of arguments that show that perhaps it wouldn't be so prudent. And of course, he has to weigh all of that information as he speaks to the various parties. That's all from the On Point team today. SA Today will have more news for you at the top of the hour. Have a good afternoon.